Across all of our work at Bloomberg Philanthropies, we really value partnership and collaboration. And needless to say, it's hard to imagine a better partner than Johns Hopkins. So much so that in our offices, we have a joke, or maybe it's not a joke, but there's a constant debate, Mets, Yankees, or Hopkins lacrosse. And Ron, it seems like yesterday that we were strategizing about what we could do to mark the 100th anniversary of the Bloomberg School of Public Health. We all felt strongly we should do something fresh, creative, and impactful to honor both the school's legacy and what we hoped we would accomplish together in the future. That's the Bloomberg way, after all, and that's also the Hopkins way. So we started to ask a series of questions. How do we make the biggest difference? How do we attack the epidemic of declining life expectancy in the United States? How do we combine the power of the Bloomberg name, the policy expertise we have at Bloomberg Philanthropies, and the academic and research excellence at Johns Hopkins? And from that conversation, the Bloomberg American Health Initiative was born. I couldn't be more excited about what we've accomplished so far and what's possible in the years ahead. It's great to be here in Baltimore, which really has become sort of a second home to many of us at Bloomberg. And it's great to be here with so many people from the country who share the same passion for improving public health. At our foundation, Ron said it perfectly, our mission is simple: to ensure better, longer lives for the greatest number of people. We have 5 focus areas, not the same ones as Bahi, but the arts, education, environment, government innovation, but perhaps it's our public health work that distills this mission down to its purest form. Because at the end of the day, this work is about saving and improving lives. And at Bloomberg, we believe the best way for us to do this is by bringing people together, gathering information, and following the data wherever it leads. That strategy has been key to Mike Bloomberg's success as a business leader and the 3-term mayor of New York City, and it's been the key to our success in tackling some of the most urgent public health challenges. The Bloomberg American Health Initiative is a perfect example of how we're bringing that approach to life. By convening and collaborating with the brightest minds in their fields, that's all of you, we're attacking the root causes of addiction and overdose, confronting environmental challenges, addressing risks to adolescent health, taking on obesity and the food system, and finally dealing with the widespread, especially gun violence plaguing our country. Not one of those problems is easy to solve, and we have a long way to go. A very long way to go. But that doesn't mean we haven't taken some big strides, because we certainly have. For instance, in the past year alone, the initiative has grown from 37 fellows in 17 states and localities to 95 fellows in 33 states and localities, and more than half of them come from organizations not considered traditional for public health. And in typical Bloomberg Hopkins fashion, we've funded several innovative programs where research meets real-world impact. Here in Baltimore, we supported policies to respond to the epidemic of fentanyl-related overdoses, specifically helping to decriminalize life-saving drug testing kits. And across the country, we've helped spread gun safety best practices, including with states to pass crucial red flag laws. And that's some remarkable and diverse cross-sector growth. Now we just need to keep working and doing everything in our power to build on the progress we've made to date. Last year's conference in Washington, D.C. was a big success, and just looking around the room, I have no doubt that this year will be even better. So on behalf of everyone at Bloomberg, thank you for joining us today. And I just want to quickly add that life expectancy of New Yorkers rose 3 years under our administration, a true victory for public health, and obviously that dedication has continued in our work at Bloomberg Philanthropies. And for that, I'd like to give a special thanks to our board member and former dean of the School of Public Health, Al Sommer. He's the one who... Al Sommer is the person who told Mike that unlike in a hospital where someone whose life was saved feels inspired to give a donation, there are no grateful patients when it comes to prevalent public health issues of our time. And the world needed champions like Mike to step up and commit themselves to the cause of saving lives outside of the doctor's office and emergency room. Clearly, Al is very persuasive, so on behalf of all of us, thank you. We've also had the privilege of working with some of the brightest minds and best people in this field, including Mike Clagg, the former dean of the Bloomberg School of Public Health, and Ellen McKinsey, the current dean of the Bloomberg School, and of course Kelly Henning, who oversees all of our public health work at Bloomberg Philanthropies. Together, they've taken that seed that Al planted nearly 30 years ago and helped to grow it into something that is now making a global impact.